Good afternoon, ladies and gentlemen. We'd like to call our workshop agenda to order and let the record show that all 7 board members are here. So at this time, we will call on one of our attorneys, Lisa Carmona, to please lead us in the pledge.
I pledge to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You know, the fun part of doing that is to see how shocked everybody looks when they get called upon. So before we start the meeting, we have a very special announcement to make. We understand that somebody at the dais is having a birthday on, I believe, this Friday. So we'd like to wish a very happy birthday to Dr. Fenoy, and it probably means that on the 20th you'll get your cupcake, but since it's so long after, we do that. So our first topic today is presentation on the Marjory Stoneman Douglas High School Public Safety Act. Dr. Fenoy. We have one speaker, Karen Holm.
Hi, good afternoon, Board. I hope that you've had some time to consider some of the recent emails that I sent to you all. To recap, I asked at the beginning of May how the public will be included in the creation of the plan over here for use of the funding of the Marjory Stoneman Douglas Public Safety Act. Our students' mental health and well-being is a very important public issue right now. 2 weeks ago, I wrote to the board asking again, and staff contacted me. I was told that a committee was formed 3 months ago, and that committee would be making a recommendation to your board. I asked again when the public would be included. I was contacted by staff another time and told that the district's plan, which is due to the state by August 1st, will be posted on June 4th and obviously presented to you today. When I didn't see that it was posted on Monday, I inquired again. It was clarified that the PowerPoint that will be presented today is an overview of the plan. In particular, slide 21 is a summary of the plan. The detailed plan, I was told, will be written starting tomorrow, June 7th. So here's my grave concern. Your staff has indicated that a committee was formed 3 months ago to address the Safety Act, the funding, and make a recommendation to the board. There's no evidence that I can find that the public was notified of this committee, nor when the public could give any input to that committee. I believe that this is a violation of sunshine. I'm very concerned, especially since the topic, as I said, is our students' mental health and well-being, a very important issue right now. Furthermore, I was told by staff that they consulted with principals, counselors, and school teachers, yet there was no formal process of collecting that information from those very important stakeholders. There were personal conversations, is what I was told. I'm very concerned because the public school system should be operating in a very professional manner that includes the public, not a private conversation type of manner. Going forward, I'm concerned that no plans have been established for giving the public an opportunity to be included in creating the funding plan. There are only 9 business days between tomorrow and the 20th when you are set to vote on this issue, and I am very, very concerned. If you would please let me know if we have a resolution to this issue. Thank you.
Thank you very much. That concludes our speakers. Dr. Fenoy.
Yes, at this time I'm going to turn presentation over to Deputy Superintendent Keith Oswald to speak on today's workshop. The first is the Marjory Stoneman Douglas High School Public Safety Act.
Thank you, Dr. Fenoy, and good afternoon, board members. I will be speaking to Senate Bill 7026. There is a lot of information that's located in this bill. For today's purposes, we're going to be focusing more around the school district's responsibility in the area of mental and behavioral health supports. but there's a lot of different responsibilities for a number of different agencies that are listed here. Again, we'll be focusing the majority of this presentation about some of the requirements in here for the school district. This is a pretty comprehensive bill that focuses not only on mental behavioral health, it also focuses on the school resource officer component at each school. We will not be getting into that for today, but again, the mental behavioral health components of this bill. So we will be going through some of the student discipline requirements, the establishment of threat assessments, an assessment tool. These are the items that we'll be going through. But a big component, the last piece, which is a lot of conversations that have been occurring around how we will utilize the allocation for here at our school district. We've been allocated $4.3 million, $400,000 to go towards our charter schools and leaving us with $3.9 million. Each school district and superintendent does have to establish additional procedures and policies to address particular threats that occur on our school campuses. We'll be talking about that. Also, we must designate a school administrator as a safety specialist for our school district. That will be our chief of police. And around those components, there are specific trainings that must occur for our school-based personnel. Also, an agency liaison for other agencies, and then the actual risk assessment. One of the big components that are new in this particular legislation is that each time a student registers for school, they, as a parent is completing the registration form, if they've been referred to mental health services, they must fill this out. They don't have to, but they have to put this on the actual registration form. This will provide new protocols that we'll have to put in place. So if a family does come and say that their child has been referred for services or are establishing services, what we haven't received from the state is any technical assistance about what we must do. So we'll have to establish some procedures here locally.
In addition, there's language inside of this bill that talks about additions that need to be made to the Student Code of Conduct. So there's 3 bullets on this page. I'm going to be following this workshop up with a workshop on the Student Code of Conduct, so some of this will be repetitive, but this is the language that we need to add in there. And what it includes is that if a student makes a threat on our campus or a false report or says that there's been a threat and it turns out to be false, they have to be referred for mental health referrals. In addition, any student who has any violent or disruptive acts on our campuses will also need to have a mental health referral. And then the third one will be any student who brings a weapon onto our campuses will have to have a mental health referral. The procedures and what that will look like are in process of being defined, but we are going to have to determine what that process will look like. In addition, Mr. Oswald just mentioned the fact that we will need to create on each one of our campuses a threat assessment team. This assessment team will be under the school safety officer, but again, it will be comprised of individuals from the counseling team, some instructional support, school administration, and law enforcement, and that they will be assessing situations as they come forward on campuses, and then also making those referrals to mental health agencies.
Each school in the state of Florida has to complete a Safe Schools assessment tool by August 1st. We're in the process of right now of sending this out to our school principals and providing the resources. This is a quite lengthy assessment that looks at a lot of facility issues. Based on some of what comes out of these assessments, there will be some additional grants that will be provided to school districts to address potential issues around facilities. So we're in process of doing this right now. Again, it is quite lengthy. Majority of this is facility driven.
Another aspect of the bill covers the role of what we call SEDNet. It's a state grant-funded discretionary project that falls under the Department of Exceptional Student Education, where it's a liaison within our school district that participates in a multi-agency network that support students with any kind of mental health concerns or at risk of mental health and possibly considering an eligibility for like an emotional behavioral disability. An example of a student would be a child who was recently Baker Acted or affiliated within Sandy Pines, which is our residential center school up in Martin County. Upon release,
this liaison would be able to do care coordination with all the multi-agencies to be able to coordinate services. Students who are multiply affiliated with the Department of Juvenile Justice or in our dependency system, students who are at risk in all of these areas would be coordinated with multiple agencies within our community, and this SEDNet person would be key for our district to make sure that supports are provided within schools.
Another major part of the bill is around mental health training, and the Department of Education, they have to actually establish a national authority on what this youth mental health awareness and assistance is going to look like and what it's going to be for this whole idea of trainer certification model. Here in Palm Beach, we've been fortunate enough through the Project Aware grant. We've already been providing assistance and training to our staff through the youth mental health first aid. We've trained over 1,000 individuals. Actually, this summer we have 20 sessions that we are going to open up to staff members and employees within our district to provide that training. And it's all around educating our school-based employees around what the signs are. Those signs around emotional disturbance, signs around mental illness, signs around substance use disorders. And so it's providing those. The state technical assistance still hasn't released what that national authority will be. We are doing the youth mental health first aid, and we're, I believe, ahead of the curve on that piece. But the bill does state that all employees within the district will have to be trained around these areas. The second bullet is around training around emergency procedures. It's going to be on the other side of the house with the safety piece, and that's going to include active shooter training. And that's going to be a new part for us, which we're going to have to develop within our district. And so that's another major piece within the actual training stated in the bill.
So now we're going to move into the actual mental health assistance allocation. So again, stated that we will have $3.9 million and $400,000 to spend, and charter schools have $400,000. All these funds, 90% of those have to be on direct services to students, and also school districts we just had a technical assistance on Monday and Tuesday. Ms. Issa and Mr. McCormick went to this particular training, technical assistance on Monday and Tuesday this week. Districts are encouraged to also use third-party health insurance as well as Medicaid to get additional funds to support. As we look to how to spend those dollars, it was very clear in the legislation, again, about the direct services. The provision here is about students who are either already identified with a particular disorder or issue or challenge, or those who are at risk and need additional supports. Also, districts are encouraged to coordinate with an individual's primary care provider or coordinate locally here with contracted services through a community. We've been fortunate here, and I'll talk in a moment about coordinating with our Birth to 22, where there's been a collective impact work around behavioral health supports, who's been really looking at this. Before we get into how we propose to spend these dollars, I want to talk a little bit about how we currently have been providing mental and behavioral health supports to our schools.
So a lot of you are familiar with this particular graphic, but this one I want to focus your attention to. This is specifically for school-based mental health services. It is one system with many supports within it. The bottom tier, tier 1 right there, is universal prevention, something that in instruction and supports that all students can access based on need. The second tier is supplemental supports for students at risk, which may involve intervention or group counseling based on that student's particular need. And then the third, more intensive level of support is where we involve more intensive counseling, maybe one-on-one specific to that child's need. And then on the next slide, it talks specifically about the resource mapping that's directly aligned to those systems of support. These resources are currently available in our schools. That bottom tier right there is what all students have access to. But when students do demonstrate that they need additional supports, they move up into that tier 2 where the supports are specifically targeted based on that child's need, which may involve supports and services from the MTSS coaches, school-based teams, any kind of support from the 31 behavioral health cooperative agreements, as well as family counseling in more of a group setting. And then when you get to the Tier 3 intensive level, now we're talking about the family counselors provided one-on-one support, more intensive services, wraparound services, or targeted case management from one of our or any of our 31 behavioral health cooperative agreements. The following slide is more specific to the curriculum and supports professional development and resources that's available for students who are accessing all actually on the Tier 1 level, and then specific resources for those on Tier 2, which includes programs and resources that are currently in place, like zones of regulation, which is a curriculum set up for students to identify their emotions and then what to do when they experience those emotions. And then in Tier 3, it's more specific and intense to make sure that students have their mental and behavioral health needs met at the intensive level that they require.
So on this particular mental health assistance allocation, it does require board approval, and it does require that we submit our plan to the Department of Ed by August 1st. So within that timeline, we're looking to bring a proposal June 20th, also so that we can start executing on this particular dollars and start spending and putting our plan in place. Again, these dollars cannot supplant anything that we currently have in place, so that's important. Also, on an annual basis, beginning September 30th of 2019, there are a number of requirements, and just Friday, we got a list of those requirements of how we have to report the data of how we're utilizing these dollars, such as number of kids who are referred for services, kids who are, which is a big component of those dollars. So we have been doing a lot of collective impact. You've heard that about here locally in Palm Beach County around different topics. There has been, prior to these dollars even coming down, a group focusing on behavioral and mental health services and supports. This is a subgroup of birth to 22. We have been working right here locally. We have a number of those representatives here today. United Way with Seth Bernstein. Children's Service Council is here today. Also, we have Youth Service Department with Palm Beach County is here, Tibby, and a number of others. The Community Foundation, who have really been providing input. When we look at really the best practices that exist here nationally around how do you support school-based mental health services, this is a proposal that we want to move forward with our district.
So what is the proposal? In looking at the fact that we are being asked to broaden the access to school mental health supports while also improving what we do as a school community partnership. And as Mr. Oswald just mentioned, we have many partners, and we've been very fortunate that they have come along with us on this walk to talk about maybe what we should put into the proposal and what we should try to strengthen and what we don't presently have that we might be looking at adding to. So the three pieces that we're going to talk about today in depth are going to be crisis response teams, school-based mental health services, and then the third piece is going to be the training and supervision. We've touched on that a little bit, but we need to talk a little bit further into what those training pieces are going to look like.
So based on the increased need and focus, we currently utilize mobile crisis supports provided by our community agencies. The intent of establishing district teams is not to replace, but immediately provide additional support to schools with trained staff in crisis intervention techniques and have various levels of expertise to support school-based team with post-crisis strategies, planning, and training school staff in order to prevent these levels of behavioral situations from continuing to occur. This also includes the planning and coordinating for students who are hospitalized under the Baker Act to ensure that schools are prepared to be able to receive the students back on campus upon release.
So you see the type of positions that we're looking at. We're looking to have licensed therapists. The reality is we've seen a large increase in the number of issues on our campuses. A kid posts something on social media to make some threats. This would allow us to have that immediate support to deploy out to our schools and provide the support to our principals to really address these in a comprehensive approach.
So the language in the plan asks us to look at mental health assessments, diagnosis, intervention, treatment and recovery services to students with mental health or co-occurring substance abuse diagnosis and students who are at risk of diagnosis. So the team has discussed that we are going to put forward a bid to provide mental health staff located at school centers utilizing the guidelines that we presently have in the board-approved 31 behavioral health agreements. So we will be utilizing the community agencies that we already have board approval on.
And through history, we have seen that the best approach, the closer we get the services at the school level, the better they're utilized. So as at particular agencies, we have a number of agencies right now that are currently working in our schools. For example, we have data counselors that are housed right in our school campuses. They have immediate access to work with a particular student as well as the entire family. And also a best approach as we look at the research out there of other systems. So again, $400,000 of this would go towards the charter schools. We do have to ensure that those charter schools are providing their plans to us and sending those to the school district. $2.5 million would go to, again, those actual school-based mental health services through that bid process, about $1.1 million towards those crisis response team, and then a small portion around the training and supervision piece. Moving forward, the reality is that, the research, this is from the National Association of School Psychologists, there's still additional needs that are out there in our schools. We know, we hear about it, about the extent of the children who are experiencing difficulties. So the board is under consideration of looking at a referendum to have additional supports. When we look at really going deeper and to provide the type of supports we do need, if our board supports going for that full that referendum and our taxpayers, our voters support that, these are the areas that we really want to address. Especially want to draw your attention to school psychologists. We want to get closer to the recommended ratio of the National Association of School Psychologists. The 96 comes up so that we could have a school psychologist on every single campus to get ahead of that work. They're licensed. School counseling, again, we want to get closer into the recommendations about the ratio of students to school counselor. The mental health, behavioral health coach for every campus. We want to have that individual who's that expert that can provide direct support more at that tier 1 level, so those kids who need support, someone to help support teachers in the classrooms where kids are experiencing some challenges, but then also be the expert to refer out for additional resources. And then there's still a need for those licensed therapists for the more intense support that is needed for some kids on our campuses, additional mental health clinicians. So we know that if we address mental health in our schools, our kids are going to just do that much better. So that concludes presentation. At this time, we'll turn it over for questions.
Questions? Mrs. Mrs. Whitfield.
Thank you. I have 3 questions. The first one would be, it's kind of a two-parter. So I understand we're going to be having to go to the different organizations on the outside in order to get the services that we need. So we're going to have to create kind of an expanded partnership with these organizations. How will we ensure that we get the same kind of quality of service from each organization, and how will the supervision of the people that we have in our schools work? That's the first question. The second one is, if we have other organizations out there in the community who would like to be a partner organization, who are not currently on that list, that would be available to be a part of this, how do they get involved, or how do they become a partner organization? And then the last one has to do with the slide you were just talking about with the ratios. I'm concerned about what recommended ratios there are out there in the community or out in the world that they recommend, number of psychologists per student. How close are we going to be able to get to those numbers, and are we going, what is the funding that we're looking at? How is that going to work, and will we be able to really maybe ramp up over time? Thank you.
Okay, so first, when it comes to the quality of the services and that approach, so this is go through a bid process of its scope of work. And again, we're going to pull the language right from the statute of what's required. So currently there's an evaluation process that we look at that we will have to ensure that it's being followed, and we'll have to look at specific outcomes that we expect. We will have to provide some technical assistance with, depending on what agencies that do want to work with our schools, about what we require and can they provide that. We're going to have to progress monitor that very closely, and if we see that certain agencies can't meet that scope, we'll have to probably end certain contracts. The reality is, too, there's a shortage of individuals that are going into this profession when it comes to mental health and supports. So it is a concern that we're going to have to watch very closely if they can deliver. And if they can't, then we're going to just have to stop certain services. But that will be outlined in the particular scope, and then we'll get feedback from our principals, from our schools, are they actually, and then from the outcomes, the data that they're going to have to provide us on how many kids they're serving. Do we see change in behavior in the kids that they are supporting and serving? So that's the first part.
There's also reporting mechanisms that are built into the Act. So starting in September 2019, we actually have to report out to the state. So we're going to have to be monitoring certain outcome data that the state is asking us to look at, and we have that specific data, and that's inclusive of how many students were referred, what type of referral, what type of mental health services, et cetera. So we don't have to report on that until September 2019, but that's going to have to all be built into our bid and the scope of the work that we're looking for.
As far as additional agencies that maybe we don't currently have agreement with, a behavioral health agreement with, we're going to encourage those to reach out to us to see if we can establish a relationship, to see if this may be a potential for providing additional supports to our schools. When it comes to the ratios, right, with school psychologists, the National Association for School Psychologists recommend a 1 to 700. Again, with getting one per school will help us get better. Right now, we're not in alignment to that 1 to 700, so we're hoping with that additional 96 that we'll get closer to that. Again, also currently, when it comes to school counselors, is 1 to 250. So right now we have schools at the elementary level. It's really 1 per school is our current allocation. This would, again, put us closer. In our high school, we're at 1 to 435 currently. So the additional 30 would get us a lot closer, that 1 to 435. And those are those two areas. With school psychologists, we're at just 1 to almost just under 2,000. So, again, we need additional resources, additional funding to help bring that numbers down.
Mrs. Brill.
Thank you, and you answered a lot of my questions as you went along. I definitely believe that having school-based mental health services is really what we need. I do have a suggestion for you. Our psychologists right now, their time is tied up in testing. Mm-hmm. And I'm not talking about testing for mental health testing. It's more like gifted testing and things like that. As you look at your collaboration and what you outsource, perhaps it should be a consideration to outsource the testing for those types of things, because these psychologists know our kids. They've been in our system. We definitely need more, and we also need to find a way that we free up our school counselors to do what they were trained to do. Right now, our school counselors spend an inordinate amount of time administering tests, proctoring tests, and doing things that are really not what they intended in their careers. So I think we have to find a way to fill those gaps, but definitely if we could work with the psychologists to see, can we outsource some of those pieces so that they could be providing the mental health support to the students who they've come to know within our school system.
Good feedback. Thank you.
Mrs. Andrews.
Thank you, and I like the startup of this program. We're now working with so many multi-tiered agencies for mental health and services for our children. Have we actually reached out to many of those that's partnering with us now to get their input on how they see themselves in a role to help us out?
Outside of The agencies that we're currently working with?
Yeah, mainly the ones that you currently work with. You have quite a few of them that's working with you now. We don't want to have to duplicate much of what they're doing, but we may have to refine and retool how they're doing business with us as we move to this new model. So what kind of communications and collaborations have you had with them to provide input
absolutely.
to this
No, that's
plan?
a great question. For some time, actually, since leaving the school building, and since I've been up in the central office, I've been working very closely a lot of agencies that are here about how we work as a community and how we have better alignment. And we're working on alignment of a community, about how we provide services. And it's crucial that we let these agencies know how it works best for us in the school district and that they align their resources to that. And I think we've seen it increase the number of agencies that are working with us. A lot of them are here today, are very excited about this opportunity for our community. And how we align those resources and to make sure it's the right work based on the national best practices that are out there. So we continue to meet on a regular basis, this subcommittee. And again, we have collective impact going in a number of areas, everywhere from the Achieve work that's going on in Palm Beach County, around ESE students. And again, there has been for some time around this mental and behavioral health. It's a big animal when you're talking about our entire community, but these agencies that we're working with, and there's many, are very excited about the conversations and about how they're aligning to our needs.
And it's important to mention that a lot of this work started right in February, once the event happened. We did not intend to get the funding at that time. We knew as a community we needed to come together to address the behavioral and mental health needs of our children.
It's wonderful. May I follow up, Mr. Shaw? And just one last piece. I talked to Mr. Oswald about it. We want to have restorative schools when we're talking about counseling and working with students, not just looking at discipline issues. I know in Palm Beach County we have level 2 and level 3, but we don't have the whole level 1 process of the restorative process when we're talking about making our schools safe for our children, working together through the mental health piece. How will that work into this plan?
Sure. We do have restorative, we have school centers that are implementing restorative justice and restorative conversations. Do we have it across the entire district? No. But with the hope of us being able to have resources at each of the school centers, we'll be able to introduce that into all of our schools. We continue to offer that training and we continue to offer that opportunity to all of our school centers, because we agree that it does start, we need to move away from the discipline and talk about restorative. And not only in the school centers, but with the community as well. We've done a lot of work with the outside communities.
Because I really do think that when children are disturbed, sometimes it turns into discipline. So we hopefully will have the mental health counselors with the other agencies working with us, but we've really got to get to the bottom of what the root causes of their problems and provide support for them.
We're also hoping with the strategic initiative around social-emotional learning and around bullying, that through the implementation through the Wallace-Pacelli schools, through our morning meetings, and now expanding next year, that we're doing more of that preventive work so that we are seeing them before, and if we're noticing those things, that we're able to get them early in that tier 1 level. So I think part of the grant with Pacelli and with our social-emotional, I think that's, we're starting to do more of that, so absolutely.
Dr. Robinson.
So I'm going to take Mrs. Andrews' last comments to be a testimonial for MTSS. So I'm sitting here itching. Where's MTSS? Just tell me where MTSS is.
So the mental health behavior coach for every campus, a lot of the work that you talk to often, Dr. Robinson, is described within this work. So that person who can be a support system for kids as well as be the expert around the resources that exist that may not be on a particular campus, but can bring those to ensure that every kid has their needs met. And so, again, having one for every single campus, $13 million.
Okay, so that's for the proposed referendum.
Proposed referendum.
So before then?
So before then, the way the legislation's written, it's really about direct services, about kids who are actually diagnosed or have the potential. So we're looking at licensed or more clinical training around mental and behavioral health supports. The crisis response team, again, we need to address the immediate concerns that are happening on our campuses that will provide that support. We are looking to reallocate some other dollars here to provide some schools with additional, for lack of a better word, MTSS coach, but in this space, around mental behavioral coach for campuses.
Thank
I think
you.
right now we're looking at.
Okay, so you know I have a long
Okay.
list. Okay, what are we gonna call MTSS now? We have what's the new name? Mental health behavior coach? That's what we're calling them now?
Well, the ones that presently work with me right now are behavior coaches. So once we start to add, because I have an additional 10 coming next year that we talked about, those will be focusing on mental health, and then they'll be coordinated with the behavior coaches. So we're trying to come up with a title that would not just use MTSS, but be more specific to the work that they're doing. So, okay. So yes, we're going to call them behavior coaches or mental health behavior coaches.
No, I was interpreting that a different way. Okay, so okay,
Exit left.
so okay, I'll come back. That's private. We'll have that conversation. Okay, so I received a text. So let me just tell you. So June 11th, the 5th annual Mental Health and Wellness Conference takes place at Atlantic Community High School, and all are encouraged to attend.
Next
Now,
Monday.
so back to my list. So this plan can be tweaked over time? Yes? Or is it like we submit the plan and that's it? And I mean, I'm assuming
So
it can
the-
be tweaked.
As was mentioned earlier, we had brief technical assistance on Monday from the state. And really, they gave us very wide guidelines of what needs to be included in the plan, which is inclusive of what is our process is going to look like. So in answer to that question, I think that we can massage it as we go along as we see that there are certain pieces that we need to beef up or that we need to pull back on. But as I mentioned earlier, very specific outcome data that we have to report back. And part of that I did not mention earlier to Mrs. Whitfield's question was we also need to talk about the specifics of school-based personnel that we have hired under these dollars, as well as community agencies that we have brought in with these dollars. Those two pieces are required. That's why they're embedded in the plan. But yes, I believe from the guidance that we were given on Monday and Tuesday, yes, we can.
And specifically, that guidance was outlined because they said every district has their own individual needs, and it's up to the district to determine how they're going to meet those needs.
Okay, so we need to make sure that, so we have these cooperative agreements, and you know, I really, really think that we have a lot of work to do with those, including the outcome measures, right? So to me, it all falls, you know, together. But we have to make sure, at least in my mind, there has to be one seamless system, whether you're a RFP responder or whether you're a cooperative agreement or whatever you are,
Absolutely.
right? And that the outcome, we have consistent outcome measures and expectations no matter what your funding stream is, right? Okay. So then I also want to request that we ensure to whatever degree we can that these professionals are working with our students and they're not operating from a deficit perspective, right? And that furthermore that they clearly understand the impact of bullying, microaggressions, based on whichever reason somebody might want to hate you, and also just the chronic stress of certain living circumstances. It just troubles me that because in my opinion, in my experience, the higher you go on the educational food chain, the more likely you are to pathologize a child instead of understanding that they are reacting to something and helping them to address whatever that is that they're reacting to. So I want to make sure that whoever, whether it's cooperative agreement, whatever the funding stream is, whether it's this money, that we specifically call those professionals together and have that conversation so that we're not adding to children's trauma.
Yeah, and the Birth to 22 subcommittee, we've had that conversation about the training that would be needed for whoever comes in to work with the schools.
Yeah, around those issues?
Yes.
Okay. And then the other thing I would like to throw out is just that people consider the possibility that a young person's substance use disorder might be them actually self-treating a mental health disorder, right? Okay, like anxiety, PTSD, yada, yada, right? Okay. And then somewhere in there, you talked about the funding paying for active shooter training. But as I understand, our school police are providing active shooter training for other law enforcement agencies,
Yeah.
Am I right? Okay,
Yeah,
so this would be expansion?
Yeah. The training here is not necessary to that. That's just one of the requirements under 7026, not necessarily connected to those dollars, correct?
Okay.
So, and that would be provided. It's just a requirement that we have to ensure that that happens, the drills.
Okay. All right, thank you. And then somewhere in all this, we have to find a way, because, okay, we have additional dollars. I'm thankful for that. I'm thankful that we are going to look at these mental health needs. But most of the people that are going to be involved in this have already been involved in this, right? And so I'm concerned that we will expand the same thing. And that whatever holes exist, we'll still have those holes, right? And so somehow we have to, I think, find ways to have conversations with our young people and their families about, and maybe it's young people who are returning from expulsion, for example, like some of the things that we've heard today. Maybe after things settle and they have a chance to reflect, they might be able to give us input on how we could have assisted, right? And so I just want to put that out there, that we need to hear from the people we purport to serve, right? To figure out how we can do a better job. And then I want to say to Dr. Ruiz, I hope that you make sure that all of our hosted school health clinics, or whatever that right term is, that they know about this, because I think all three of them can provide some of these services, and they're already going to be there. So maybe that's
next quarterly meeting. That's on the agenda for us.
Okay, great. And then okay, so the last thing that I will say at this point is just to make the board aware that there have been some very, very preliminary conversations about adding behavioral sciences choice programs so we can start growing our own, so to speak, psychologists and mental health counselors and so forth. So that also means let's move forward with that. So, okay.
Mrs. Brill.
Thank you. And I'm just going to add on to what Dr. Robinson mentioned when she first started speaking. On June 11th, we had received information from Dr. Bernstein regarding the 5th Annual Student Mental Health and Wellness Conference. Looking at the agenda and the breakout sessions, I would like to ask the superintendent, through communications, if we can make sure that we get this emailed out to all staff at the schools. Teachers are out. You know, they may be able to go. Other school personnel may be interested. If communications could get this out, this information through email, because it is available to anyone who wants to go, and it covers everything from suicide to the trauma impact and what it does with academics. So I'm going to forward this to our chief of staff. And okay, thank you.
We'll send it again.
Mrs. Andrews.
And thank you. And I just am very pleased with all of our agencies that work with us, because I've just been out there with some of them as they've worked in our schools. And I know they're out in our schools. One of the things I like about this plan, we're just beginning, and we want to have this in every school, but we have the information as we speak of what schools are so much in trouble as it relates to the climate, the mental health climate of many of their students. So will you be bringing back to us some type of information or data to show how well we're doing in all of our schools? I mean, we should be able to look at the different cases that have come up at particular schools as we begin to put this action plan together with all these people and agencies that will now come into our school. They're already into our schools, but now that we're putting this piece together, we may have to kind of accumulate a different strategy on how we're going to deal with the school. So I'm looking at something that's going to show me, you know, from this whole school district, how we're looking as it relates to the needs at each school. Some may have more prevalent needs than others, depending on the kinds of situations that have occurred at these schools over the last maybe 5 years.
Yeah, absolutely. That's a great point. And we are looking at a number of data points about how we target those school-based mental health supports. To your point about those schools that are in a need for additional resources and targeting those schools first, there is a data requirement that we do have to put up annually that we'll submit to let you know about those outcomes.
Thank you.
All right. Any other questions? If not, Dr. Robinson.
Okay.
Okay, I need Dr. Ruiz to speak. Now, I harass Dr. Ruiz about this stuff all the time. And so, okay, I'm going to say you going to say it, or are you going to say it?
About our strategic initiative, where one of our strategic initiatives definitely is around aligning our behavior and mental health services. So that's what we're working on right now in terms of our blueprint, in terms of creating a portal where we are able to see exactly what the needs of the schools are, let them identify these are the needs that we need, and then we have our partners in the 31 agencies that say this is what we can provide, and then having some outcome measures where we can see exactly where the needs are and we can fill the gaps in. And so that's one of our major projects, having a portal, having it out there so schools can see exactly where we're at, and then provide that data occasionally to the board. That's something that is high hopes and coming soon.
All right. Thank you very much, Dr. Robinson. Mrs. Andrews?
And that's what I was talking about from the beginning, because I know these agencies are in many of our schools, but we may have to fine-tune how we do business as we put this model together. And certainly if we had that portal, we can actually see, as I'm walking into a school, I could know where the school is as it relates to these kinds of issues and what kinds of support services are they getting and do they need.
Dr. Robinson?
Thank you. So, I don't know, the superintendent may want to share with the board that mapping of the services through the cooperative agreements. It was really very interesting when they mapped it, because it was my recollection, so you guys tell me if I'm wrong, was that basically it was like a C. It went like from Jupiter around to Wellington and down to Boca, right? That's where the disproportionate services were as compared to need, right? And so that's what I'm hoping that we're going to address and prioritize through this. Thank you.
Absolutely.
All right. Thank you very much. The only comment I have on this is that when everybody looks, especially the slide that's up right now, just to meet this need, $25 million, and this is money that we're in a position that we've got to try to run to get, and we're not getting support at the state level from the legislature to do these things. So I think that that's an important part of this. So thank you very much. Our next topic is our global education.